All right, everybody, welcome back to the Firehouse Medic Podcast. This is going to be a special run of episodes for us. We're actually a little bit late for Nurses Week.
Yeah,
a little bit. Maybe we'll save these for next year.
Was last week,
as well.
No, don't worry.
Well, we're going to have some of the nurse wives in to talk, and we're going to do. This is going to be what, 3 parts, you guys?
3-part, yep.
All right, so we're going to have my wife on, which she is the first guest. Elizabeth, say hi to everybody.
Hi.
Then we will have Devin's wife on.
Yep.
And then we'll have Alex's wife on. All 3 wives are nurses with different backgrounds, and we're just going to kind of have a cool, laid-back discussion here of what the interactions are like between nurses and paramedics in the field, and the different specialties, the things that they're interested in, and just kind of have like an open dynamic. And everybody's going to get to ask questions, and we'll put the wives on the spot. I know Liz is just raring to go.
Super excited about that.
You got the classic stereotype of 3 out of 4 of us have nurse wives.
Yeah.
The classic stereotype.
Right. So that's why.
Somebody's wife was the smart one.
Yeah.
Yeah. Probably you, right?
It was suggested to have her on, though, still, because if you think about it, you guys, the perspective, yes, a lot of times in our field, I feel like if you talk to nurses, firefighters are married to nurses, cops are married to nurses, other firefighters. It's just a common thing in the field. That's who you're seeing and interacting with, whether it's in the hospital or you met them when you were clinicals or, going through school. Those types of personalities kind of mesh up.
Yeah, they do.
So I think you see that everywhere. And when we started talking about different topics, of course, our main stuff is, critical care, EMS, and just EMS based in the fire service as a whole. But these are all other things that I feel like don't get talked about as much, these interpersonal relationships and how all that stuff works. And then we can kind of bring some of the nursing stuff into that.
For sure.
Anyway, and I don't even know if she'll get enough words in while I'm in here to
Nope, probably not.
All right. Well, Miss Elizabeth, my lovely wife, if you want to give like a little bit of a background, just how did you get started in the field in general, being the fact that you are an NP? I tell everybody this. They're like, oh, your wife's an NP. I go, yeah, she's a nurse paramedic.
So she's a smart wife.
So go ahead.
Well, all I ever wanted to do was be a veterinarian, but that's really expensive. So I tried to figure out what I could do that I could take classes, be a nerd, go to high school. So I actually got my EMT license when I was a senior in high school.
Oh, nice.
1995.
It's okay, Gannon. We weren't born yet, bro.
Were you born, Josh?
All right.
Clive is the only one. Josh is the only one.
Mr. Producer over
Josh is
there.
old man.
He was born, but me and Gannon weren't.
Oh, gosh. Got my paramedic license in 1998.
I was born.
Oh, you're
not yet.
You were 90. Were you
I was
98?
Still not?
Nope.
Wait, what month did you get it?
December.
Oh, I was born.
Oh, I
I'll be
wasn't.
darned. So it's
Yeah, you still baby.
3 months behind.
that means that you and Douglas, you and our oldest are, because Douglas
He'll be
was
28.
December 98.
Oh, yeah, I'm August.
Wow.
Yep.
Yeah. And then, so we were in a household trying to raise 2 small children with 2 paramedics and 48-hour shifts, 24-hour shifts.
Really hard, actually.
So it was one of 2 things was happening. Either we were relying on our family to watch our children, or we were having to swap shifts back and forth, which means you don't really see each other that often.
Yeah, it sucks.
So then I was like, I got the bright idea I would go to nursing school because they have better shifts. Not really.
Yeah, it's just different.
You start on night shift, so that's really not much better. And that's really how I ended up where I'm at. I started as a paramedic actually in the ER, and then I transitioned into a nurse in the ER thinking, I'm going to know everything I ever need to know and I'm going to be amazing at this because I was a paramedic first, and that is not the case at all. There are so many things that you don't know that you think you know. And then you start, and it's just not that way. It was a transition for sure. It was difficult.
I automatically thought I knew more than nurses. You know what I mean? Just because
most paramedics do think they know more than
nurses.
There's a nurse here. I want to really just say I do, but
right.
Can you go to the gas station and get taquitos and hot dog rollers? No.
Yeah.
What's
I
up?
mean, I think there's a long-standing rift, though.
Oh,
we
yeah.
call you
100%.
ambulance drivers. You call us doctor helpers. So
Oh, yeah.
Well, I've
everybody
actually never
thinks they're
used that, but I
smarter
will
than
now.
the other person.
You've never used that?
No, Dr. Helper.
Oh, I
Where
do
you-
it every day.
I've never heard that.
Helper?
Emily will tell
No.
you when she's on next episode.
No.
Narcotics and refreshments, man. RN.
I,
My wife has a coaster of that. She puts it on her coffee cup every day she goes to work.
I
It's
will
awesome.
say this, you guys. She was my boss, though, when we met, and I don't know if maybe this now that this goes out to the world, but this is something that I don't know
Still
if
am.
everybody discusses or not. But this is the weird dynamic. So I have probably, like the rest of you guys, very type A and somewhat of an ego. Even if I was in paramedic school. My wife, we were dating. I don't think we were married yet. I was in EMT school. Or in paramedic school, I was an EMT working for this 911 ambulance service in the rural area, and she's the paramedic lieutenant on that shift. And not only are you dating this woman, but now they're also your boss, and they're also a paramedic, and I hate when people say just an EMT, but at the time, that's how I felt like, oh, well, I'm just an EMT. That's not the case. I mean, some of the best partners I ever had, and sometimes I would
100%.
prefer to work with a really good EMT over a medic, so that's not what I'm
All
saying.
day.
Yeah.
But what I felt inferior, and so there's times when I would cop an attitude or be like, well, you guys didn't follow the protocol. Like, I know all the protocols because I'm in paramedic school and you did it wrong. Just to let them know.
I'm looking at our producer just from.
Was he the same way, Devin? Was he the same way when he was working with you as an EMT?
Oh, well, you will enjoy
I knew
this
it.
story.
Oh, yeah.
You will enjoy this story.
Yeah. So the worst fight that I can remember that we got into when we were dating was over an EMS thing. So I don't even remember what the situation was. I think it was, remember back, I don't know if
She
you
was
guys
elderly
remember this.
from a nursing home.
Yes.
Oh, she remembers.
Oh, I remember.
But I don't know if everyone
I can see it on your
recalls
face.
this.
You remember?
If you weren't in EMS years ago, we used to do any unconscious unknown origin was Narcan, D50, and Thiamine.
Oh, yeah.
Remember, she
That's
was
what
elderly in a nursing home.
That was the old coma
Yeah.
cocktail. I don't know if you guys were taught that in school
No,
because
no.
this is, I'm
was past our
talking
time.
old. Like I went to, well, I say old.
My
I
first
went to
private
paramedic
service
school in
was born.
99.
The first private service I went
Before I
to
was
still had that protocol.
Okay. So that's what they were, that to me as an EMT in medic school, they're actually real paramedics doing the medicine on the street. But in my mind, you didn't give this lady Thiamine. Like the whole protocol is Narcan, D50, and Thiamine. So I remember getting to the hospital and her and her partner are both medics. And I'm like, acting like I'm upset, like this could have actually harmed the patient by not giving him the Thiamine. I'm like, I'm just totally
life-saving
Thiamine. I'm
Thiamine.
like, I'm so disappointed. Like, I want to work with people that are, high speed, like that do the full protocol. And you guys totally messed up and didn't give her Thiamine.
I've seen you do that before. Working with you too, I know exactly what you were doing. I can see it
no.
already in my head.
This is Gannon's going to bring up the time when I told him to put some pep in his step, getting the vent set up. I'm like, you're taking too long, Alec. What the heck is going on
I
here?
haven't put it. It's been a month, Sean. Okay, give me a second.
I'm like, you're not going
I
fast
know they
enough.
need it. Just give me a second.
Yeah. So anyway, this caused that was the Thiamine rift of like 2001 or whatever year.
see, I
or
was born.
No, so it'd have been 2000. Yeah, it'd have been in 2000 because I hadn't finished up paramedic school yet, so it had to be in 2000. Yeah. Yeah. So this has been 26 years later, and it's still a thing.
It's
We'll
hard.
talk about it every now and
honestly.
then.
It's hard going from the book to the street because the book, you're like,
Oh, it's so hard.
protocols. Yep, this is just like the book. I need to do everything by the book. And then you get to the street, and then it's like,
book
well,
medicine.
actually, it's different every single time, actually. It's
Yeah.
never the standard ever,
No.
actually. It's so different.
Which is why you should always follow your protocols.
Yeah. Oh, yeah. We were talking about that. That disclaimer needs to go out. We need to have that, before hey, no matter what we say here, follow your own local protocols.
That is
You know
true.
what I
Your
mean? That's our
protocol says
disclaimer.
give Thiamine.
That's going to be
Yes.
You
this
give
one's
Thiamine.
disclaimer, but for future episodes, we
Yeah.
definitely need to
Yeah.
add
Because
that.
we really got into some stuff with the old hocus pocus. You know what I mean? And you don't want people to be, or with Dr. D, those guys said don't give epi and V-fib. So that seemed like a good thing, Always
Yep.
follow your own local protocols. But back onto our story, that was kind of like, it was just weird to have that feeling where you really felt, and maybe that was my own ego. None of us should ever be feeling inferior to anyone, no matter what level you're at. But it's just so weird when it's like the woman that you love or the girl that you're infatuated with, now they're sitting in a supervisory position, plus they're a paramedic, and all of us in this field are like, you have that feeling like, when you're an EMT, like, oh man, I wish I could start an IV here, or I wish I could do this, or I wish. And it's just a funny dynamic and I don't think things have changed that much, you guys. If you and Devin, or if you and Josh had the same.
Yeah, I mean, I say that jokingly to Josh, like, just because, like, Josh was a lot more, he's really good at remembering protocols, like, verbatim.
Nerd.
And so even when he was a new medic and I was, I've been a medic for 3 or 4 years at that time, like, he would go down the protocol. And there's some funny stories that we had that, like, I went off protocol and whatever, and it ended up working out in our favor, thankfully. But, so that's what I meant by that. He just knows the protocols, like, extremely well.
I had the same thing when I work with Josh too. He'd be like, "Oh, shouldn't we have done this?" I'm like, "Listen, man, I'm kind of an idiot. All right, listen, okay, just trust me on this one.
Right.
Either either it was a true mistake, or like we're just going a different way. But like, just trust me, man."
Well, when you come out of school, or when you're in school, the EMTs that we're working with that are in paramedic school, they are up to date on. They are going back through class. They are up to date on most of the newer stuff. They are the ones memorizing all the different drugs, the dosages, the side effects. All those things they're really in tune with because they're in school and it's in front of them all the time.
Yeah, and let me interject something with that. I think that as somebody who has been, in this field for a really long time, I think you have to be able to appreciate what the newer, group of paramedics bring to the table, and don't be that person who says, "This is the way we've always done it," or "I've been in this situation longer. I've been in this field since before you were born, so I know more." Nope, that's not right always. So that's the only way that you're ever going to embrace change in this field is when, honestly, I'm going to say it because I'm controversial like that. The older generation can put aside their pride and put aside, the fact that they may not know the best way and just be open to things. That's the only way it's going to happen.
Yeah.
Just because I've been a paramedic for 30 years does not mean that I deserve a spot over someone who's been a paramedic for 10, because I'm going to be honest, they're probably a better paramedic. I wouldn't do well out there on a truck right now.
Yeah, no, that
I can accept
even
that
people
fact.
that are on it's I think that is a really good thing to always remember. Even in the 3-year gap that Josh and I have, like, there's things that he brings to the table that I'm like, oh, well, I didn't even know that.
And on the flip side, there are things that people that have been doing this for a really long time can, street cred, as you guys call it.
Yeah.
There are things that they can bring to the table, but
100%.
Egos have to go away.
Both parties can learn.
Absolutely, 100%.
And I think a lot of times we're stuck in either one or the other. And I totally agree with everything you said, that there is something to have seen a bad PE patient, and had that and experienced it, than to read about it in a textbook or go through a simulation.
Oh, yeah.
You get a little bit more, you've seen these things, and that's what experience gives you. Same thing as working a cardiac arrest. Like, hey, you might have been through ACLS and paramedic school, and you guys might have run 10 mock codes, but when you have to go lead it for real in a dynamic team, those are totally different things. But I do think this EMS as a whole has this weird thing of eating their own. Even the fall, I guess, eating their young. Yeah, I think the fire service is the same way. Like, man, it can create like toxicity, and I think that all of us have to be more aware of that. You want to talk about reasons why we're struggling with mental health? Half of it is our own doing.
Oh, for sure.
It's the way we treat each other, the way that the system is built. Not wanting to give a hand up. It's more like, hey, we're going to wait till you're drowning, then we're going to put our foot on your head just to make it seem that much tougher, or whatever the reason is. We should be training our replacements constantly. That's what the goal should be here, is you're training the next guy to take your spot, and that continues all the way up the ladder. And I think that that's how you get cultural change. And I think that's a great point to bring up. It really is. We do see that. And I know that my wife, she also had not only the background with being a paramedic in a 911 system, also as a nurse in the ER, ICU, well, you floated all around.
Wow, you've been a bunch of different places.
Oh, yeah.
I have been.
Man, nice.
Oh, wow.
She was on the helicopter for a brief period of time. She wanted to try that out for
I know.
Mercy.
It's my dream job, and it just wasn't.
Wasn't always cracked up to be.
Not for me.
And what was the problem with that? Because my mom did the same thing. She was a medic, and then she went to be a nurse. She was a nurse, went to be a medic.
I think I did.
All to be on a helicopter, and then she found out too. It's like, it kind of sucks.
So I have a lot of ear problems for one thing.
Oh yeah.
Like structurally. So I had a lot of problems with that, and a lot of anxiety sitting in that, not on the way there, not with the patient, but then on the way back when there's no patient there, and suddenly you're like, oh, I'm looking out this window, and there's not much keeping me from crashing on that ground there, and it just built and built, and then again, like our youngest son, I think was 6 months old at the time.
That's
and we had a 4-year-old, so there was just a lot going on. And honestly, when I was in rural EMS, you would get a bad patient, you would call for the helicopter, and you would get like this, oh my gosh, the saviors are here. And then when I was the helicopter, I didn't feel like the savior. So
it was more like, where's the transfer? We're here for this transfer. That was my experience, being on the helicopter for the 3 years I was.
And and also I was not a critical care paramedic. So we were picking up patients in the ICU and transferring them with medications I had never heard of, didn't know what they did. I have a very high standard for myself. And so I am not that person who is just going to ride along and get a paycheck and just, be like, I
don't know any of those people.
I know. I'm sure you don't.
Familiar with any.
Nope.
I can't do that. I just can't. That causes me a lot of anxiety and a lot of angst, which is actually why, as I've gotten older, I've kind of tried to transition. I was a float pool nurse. So all during COVID, I worked in the ICU and the ER in a small rural critical access hospital, which you think would be, no biggie. So we had no intensivists there. Our intensivists were via telehealth on the screen.
Oh, man.
But we had all of the same patients that we had patients come from, the St. Louis area because there were no beds for anybody. Mm-hmm. So our patients had 6 drips, 8 drips. They were on a vent. They all had art lines. They had everything that your patients up here had, only you didn't have an intensivist there. You had a telehealth, push the button on the wall. A lot of stress there. And as I've gotten older, I just realized that I've stressed for a long time, and I just want a little roadway to retirement.
That's fair.
Think what she just brought up there too, you guys, was COVID rough on all of us who were, on the front lines of this? Absolutely. Yeah. But it's hard to imagine in that situation, you guys, you're the nurse. There is no intensivist there.
Yeah.
These are some of the sickest patients you can have. And it's you, the telehealth doc, or you and the NP, and that's what you're rocking.
That's hard.
You gotta wait for a phone call, so to pick up the other end and get on the screen.
No, you just hit the button on the wall. Excuse me. And they would come up on the screen. Yes, and they were very quick about it. But
it's still not the same.
It's not the same.
No, it's not the same. It's absolutely not the same. I will say that doing that time in the ICU during COVID was worse for my mental health than 20, 15 years in EMS.
Oh, 100%. Yeah.
It was like
COVID was terrible.
Going to work every day and beating your head against the wall.
Yeah.
Knowing that, you're going to take care of these people and they are probably going to die.
Well, and to your point, like if we've forgotten or not, I think nurses had it worse in COVID.
Oh, 100%.
We
100%.
got to just drop off and then just take our gowns off, take, the masks off, throw it away, and just go on to the next one. I mean, though you guys were in the gowns all day, masks all day, 12 hours a day on your feet, multiple patients, because you guys couldn't, there were so many patients that you guys had to take more patients than what was, if I remember, a lot of times.
All the rules went out the window during COVID.
Yeah, all the rules went out.
You
guys had to, if your normal patient load is 3 patients, you may have had 5 or 6 patients because there's just that many.
Remember, you guys' expiration dates no longer mattered on the drugs. That's what? All of a sudden, it's not a big deal.
Yeah.
It just was a different time. And in times of crisis, you do what you have to do. But I won't forget, I've never seen her come home and crying and just, you've got all the lines on your face from the masks and all the stuff. And it just, there's a lot of people, I'm sure, in this field of healthcare that bailed out. You know what I mean?
Don't blame them at all.
Yeah. And
don't blame them at all.
You can't blame them for that. And I think that for all of our sakes, you then have to reevaluate your life in order to improve your mental health. And does that mean giving up healthcare? In some aspects, for some people it probably did, and in others, and that's okay. For others, it was, hey, nursing allows me to have this very broad range of things that you can do. So you look to do other things in the nursing field. That's the nice thing about being a nurse is,
it's like the coolest part.
It is.
You indefinitely have a way to always avoid burnout in a way.
Can.
Yeah,
right?
and I love the bedside. I really do. That's another, thing that we talk about. Sometimes people think, well, you have no drive if you don't want to be in management. I don't want to be in management. And guess what? If you're sick, you don't want someone in management taking care of you.
Oh, heck no.
I have zero desire. I've been a house supervisor before that was more management than I ever want in my life ever again. I love the bedside. I love taking care of patients. I love talking to patients. That is what I love to do. I'm still able to do that in what I'm doing now with, I call it negative stress.
Yeah.
Same money,
what are you doing
negative
now?
stress. I work at a local urgent care.
Nice.
Oh, nice.
So,
there you go.
Same money I was making being in the ICU, negative stress.
There you go.
Nice.
And it has changed a lot of things. But I want to bring up something that you just touched on there, you guys, because I want to bring that back as well to what we're doing here. Think about this in the fire service, or it can be EMS based solely as well. But I'm just bringing this up about the fire service because that's what we're in. You're considered like, I know it's not openly spoke about, but if you just want to ride, if you want to be a backstep firefighter, medic, you enjoy that job, and you're like, man, I just really love what I do. After a while, people are like, man, what's wrong with this loser? Like, he's not an engineer. He hasn't promoted up to captain. Like, he's been in that spot for 10 years. Like, this dude must not care about the profession or their job. How did we get to that? Like, what's wrong with wanting to just enjoy where you're at and be really good at that spot? And you found a position and you're doing a job that you love. But we seem to be, our society, our culture is, well, if you're not moving up, you don't care.
Yep.
Yeah.
You always
I
get
think
something
it's the same
better.
with nursing.
Yeah.
Oh,
You're never satisfied with what you have. You always have to have more and more and more and more.
Yeah. And maybe that's not just
trap.
our profession. I think that's society as a whole, right?
Yeah, I think so. I think it's bled over a little bit.
But it's definitely a palpable thing you can feel within the service is just if you're not moving up or you're not taking promotional exams, you don't care. And now, are there some people that will hide out in that position? Because, look, you don't have to do reports. You don't have the responsibility of driving the truck. You can still stay asleep going to the EMS call till you get there.
Yeah, it's a great job.
It's a great job. And now listen, we're giving you all the highlights of it. There's the times when they run all night too, or you're out all night on the fire, or it comes time to you having to go to work, and it's physically demanding and it's tough.
Right.
So I'm not trying to whitewash that. What I'm saying is there are some people that I know that even work for us that truly just enjoy doing that position, and they're very, very good at it. They could easily promote up. They just choose not to, not at the present time that they're in their life. And when they do something, they do it 100%. And if they're not ready to go all into leadership or to driving and operating the fire apparatus, then they're not going to do that. And there's nothing wrong with that.
Right.
Yeah, it's a good thing.
I'd agree. I want to go back to you working in the urgent care. So Alex's wife is ER, so we'll kind of talk to her a little bit about ER stuff. And then my wife's ICU, which you've kind of already mentioned a little bit. But what about the urgent care perspective of like when you have to call 911 or, kind of go into some details of how that relationship works.
Don't name names. Don't name names.
Yeah, don't name names.
I will not.
I've been in an urgent care where I've had partners and the nurses go at it. So
you're going to get into her pet peeve now, dude.
But yeah, let's talk about it.
I mean, I think a lot of this has been a pride thing for me to get over my pride, because I did feel, and I don't know if it's that society makes you feel like this, or if I just felt like this, or if first responder, this family makes you feel like this, the kind of you're downgrading, like, oh, I used to work in the ER and the ICU, and now I work in the urgent care. So I think sometimes I feel like, is it nice sometimes to be able to be the one to call 911 and not have to be 911? Yes, 100%. Again, negative stress. What is not nice is that when 911 shows up, they very much let you know that your place is on the bottom of their shoe.
Yeah.
And that you are probably, they'd have no idea what I've done. They have no idea what my credentials are. They don't know that I have been a paramedic probably longer than they've been alive. They don't know that I've worked in an ICU. They don't know that I chose this route because literally I did not, like, it was either doing something that was not fight or flight constantly, or it was quitting nursing. Will I go back to something else? I might find the burn unit is where I've always wanted to be, really.
Oh, really?
Yes.
That's interesting.
Yeah, I know.
Why?
I had a really bad burn patient when I was a brand new paramedic. Really bad. 77% second, third degrees.
Holy cow.
That was his official, yes. And I think it just stuck with me. He came back to the ambulance base 3 months later.
No way. Took a visit, sent thank you and everything?
Yes.
That's really cool.
It was amazing. And that was before RSI. That was before I actually got in trouble on that call because they gave him 10 milligrams of morphine at once.
Oh, God, 10 milligrams.
I know.
Oh.
But back then, that was a big deal.
It was. I remember. Yeah.
We didn't even have protocols that had
No, there was no
narcotics in
standing
them.
orders for narcotics.
Absolutely not.
Yeah, no one had that.
I got in big
Crazy.
trouble. And guess what it did to him?
Nothing?
Nothing.
Yeah.
Yeah.
He still screamed his head off the whole time. But yeah, so I think that sometimes you feel like you need to walk around with a little cardboard sign on you when you have to call 911 from the urgent care that says, I'm not an idiot. I know what I'm doing.
100%.
I chose to come here. I didn't get demoted. I didn't get in trouble. This was a choice. And I'm pretty smart because I'm making the same amount I was making for working like 20 times as much.
Yeah.
That's awesome. Was that the same kind of that vibe between EMS and urgent care staff? Was it the most extreme version you've seen of it, where it's such a big drastic difference between like ER, ICU, being in the field previously? Like, did you expect it was going to be that drastic of a change?
Like the way I would feel, the way they would.
like the way EMS treated you versus going that role?
Kind of a little bit. I know how EMS treats nursing home nurses. Now,
I forget about that too.
you know,
You kind of do lump them all together, sort
there
of.
are some amazing nursing home nurses out there.
There are. I've ran into a few.
There are some amazing
A few.
doctors out there.
A
There are
handful.
some not amazing nursing home nurses and some not amazing doctors.
There's some bad paramedics.
Exactly.
There's
Yep.
some bad
Yeah.
critical care paramedics. I mean, you can.
I
Every
think
level.
Yeah.
I think one thing that you forget is when you pick someone up from the nursing home or the urgent care, I mean, most of the time they don't want a report from me.
Yeah.
And I had one argue with me the other day over AFib and A-flutter. And I'm just like, okay, whatever. But I think you forget, you are the line between that patient and their care for the rest of the time that they are. So if you are dismissing the nursing home nurse and she's trying to tell you something and you're like, I'm not listening to this person, they don't know what they're talking about, you potentially could be harming that patient because you're not bringing to the table all the things that have been going on with them. Or it's the same way when you pick a patient up from their house. You literally, the nurse and the doctor are not going to their house to see what you saw.
Yeah.
They're not picking up their medications. They are not, and half the time people don't even know the medications they're on. And if you go to Mercy and then you go to Luke's, and I don't know if I can say their names, but just local hospital, they don't like share information. So if one patient always uses their doctors over here at this one, and then suddenly we're taking them here, they're not going to know anything about that patient.
Right.
They're not going to know maybe that they're watching a AAA that they have that's right at the spot, or an aortic aneurysm that's tiny that they're watching. They're not going to know that because they're not going to see any of that, and the patient may not be able to tell them. So those are super important things. I think don't get caught up so much. Yes, obviously get caught up in patient care, clearly.
Right.
But there's enough resources that you guys typically can take to the scene that somebody can be making sure that they're getting information somewhere, somehow.
What about some of your fellow nurses in the urgent care setting? Are there a lot of nurses that have gone similar pathways as you, where like now it's like, okay, I've done the ED. I doubt there's a lot that went paramedic to nurse.
I do work with one.
You do?
She was a city paramedic.
Oh, wow. Okay.
Yes, for several years, and then was an ER nurse, and then kind of the same
pathway.
As I'm getting older, I say the urgent care is where ER nurses go to die.
There you go.
Kind of like the MLS, you know what I mean? Where all the great soccer players over in Europe, where they come to end their career. right here at the MLS in the US.
I mean, we're just tired.
Yeah.
But there are some now. I think that you should have to have ER experience before you work in the urgent care.
Oh, okay. Why is that?
We get really sick patients in our urgent care. The average age that we see is probably over the age of 70. Brain bleeds. In the last 6 months, we've had a flail segment with a pneumo.
Oh, wow.
We've had...
What?
This is what you guys need to hear. This is interesting.
This gentleman fell and had 6 vertebral fractures, a fall with a brain bleed. A lady just a couple weeks ago drove her car into a house and thought that we were where she needed to come.
Nice.
Cow.
Yeah, we see a lot more than what you would think.
Yeah.
Because people, they can't get into their doctor.
Yeah.
And they don't want to wait 8 hours in the ER.
Yeah.
Yeah, especially in St. Louis, because, I mean, all the appointments are 3 months out usually, or 6 months if you're a new patient. And then all of them now, you get sent to triage or you're just going to be there for hours.
Probably not getting in less than 3 hours.
Yeah. People ask us all the time now, especially after COVID. We're like, am I going to be able to get a bed or, can we go past triage? I'm like, before COVID, yeah, it was possible. Nowadays,
it's just not.
Unless you're dying, you're going to triage. That's just how it is now.
Yeah.
And I don't care what hospital it is in our area. And you guys, we are very blessed in St. Louis County to have, world-renowned children's hospitals and, educational trauma centers, right? I mean, it's amazing the resources that we have here in this area, which is another reason why I think our EMS and in this area is very progressive for the most part compared to the rest of the country. But what I'm trying to say there is they've all become these, I don't care what ER you choose to bring your patient to or where they want to go, they're all the same. It's just overflowing hall beds. And I think they're experiencing this around the country. I don't know what the answer, and we're not going to have the answers to that on this podcast, but you're right, which is pushing more people to the urgent cares, to telehealth, right?
I also had a gunshot wound.
Oh,
I went to
no way.
Yeah.
Where was it?
His hand.
Oh, okay. I was like, if it was like in the shoulder or something, I'd be like, that'd be crazy to think that.
But you don't think about that.
Still is like you should know not to go to probably.
Yeah, no,
but you guys
upset.
think about that. So they roll up into the ER or to the urgent care.
Crazy.
They've got to contact law enforcement, all the other things that go along with, this guy just showed up with a gunshot. Well, you could say whatever you wanted. You could have a deceased person at the house too. You could have been involved in whatever.
Right.
Yeah.
So there's a lot of aspects that, you think, it's an urgent care. What can they possibly see there? I mean, we should never take for granted when we go there, because that means at least a mid-level or a physician has seen this patient and saying they need to go somewhere else. And no matter what we think as paramedics or critical care paramedics, unless you're working as a paramedic PA or NP, you don't have more education in most cases than the mid-level, and you surely don't have more than the physician. Now, am I saying that automatically makes them right over you? No, but it deserves and should at least demand some respect for the title, and at least from us to be an advocate for our patients to stop and listen to what they have to say.
100%. I
do kind of appreciate, out of all facilities, I don't mind going to urgent cares because usually I get a report directly from the physician, whoever the highest guy is. I get that report, and that's like so nice, because every facility you go to, it's a bear trying to find who's actually in charge of the patient usually. So that's a good change.
Just to kind of talk a little bit more about paramedics and urgent cares, I think the only problem that I've ever run into at urgent care is the nonchalant call that gets called 911 for, and you show up and the person's like, I don't want to go by ambulance. I don't even know, like, they didn't even tell me they were going to call. So can you kind of talk about like that situation of like, how can paramedics do better in that situation of like not making the urgent care mad, but also following what the patient asks, and how on the, vice versa.
Diplomacy.
Yeah. Like what can both parties do?
I've not had that, just because I feel like we are really good at explaining to our patients, and you always have an option. That's what I tell people. I'm like, listen, you always have an option to say, I don't want to go. Well, I'm not going to force you to go anywhere. I'm going to highly recommend that you go by ambulance. Right. And so sometimes people that are on the fence will change their mind. I think though tone is a big thing. I have had a lot of people I understand that you have to get permission from the patient. I get that. Like, again, that's where I understand because I've been there before. But it's just the way that you word things too. You know, if the patient outright says, I didn't know I was supposed to be going by ambulance and I don't want to go, well, then I don't really know there's much.
Right.
It's kind of out of your control. Sometimes they change their minds and maybe sometimes they weren't explained exactly what was happening. But a lot of times what I hear is, oh, we're here to take you. Do you want to go to the hospital? There is a better way that you can word that where it doesn't, because the patient a lot of times is like, well, no, I don't really want to go to the hospital, but they told me they can't fix me here. So I kind of don't have any options. So when you say, well, do you want to go to the hospital? And they're like, well, no. Well, then now it just really, there's a lot of, I don't know, it makes things very uncomfortable sometimes.
Like going back to that specific time that I'm thinking of, like it was a little uncomfortable. I didn't necessarily go in there and ask that, or my partner didn't either. It was we walked in and they were like, who are you? Who are you?
Well, that shouldn't happen.
Well, then that is definitely a problem on the urgent care side.
Which was, but then because of that, it was a whole fiasco. We had like the physician come in and like, it was a whole deal. But to avoid those kind of conflicts going forward, I do remember as an EMT going into urgent cares and having medics ask that question.
Oh yeah, on purpose.
Do you really want to go to the ED?
Yeah, of course.
Right.
I do remember that.
And that is about the tone that it comes with.
I can't say that I've never done it. I don't know. I won't say here. I don't remember.
You got half a smile when you're saying it. Like I can
because
see.
I could see
myself all of us
doing it once or twice.
We all know how I word questions.
But
okay,
I just
we all
don't
know.
remember if I have. But I could probably see myself doing it if I didn't think it was.
That's like saying what sounds better.
You're right. I mean, I'm putting my pride aside here. Like if I did do that, that was probably wrong of me to do.
Does it sound better to say the patient declined or the patient refused?
Yeah.
It's the same thing. You can.
That's a good way to word it.
It's the way that you word
things.
It's the way that you word things. It's the way that it's the tone of your voice that, you can come in there and say, hey, we're here to take you to the hospital. You know, I just want to make sure that you're okay with going to St. Luke's or you're okay with going to Mercy or you're okay with going to, better put Barnes in there. So I hit all the
it is
St. Clair.
I think it is about our approach. You guys.
Definitely.
And this is going to be great for these next few, just to be able to talk to the wives and from this perspective. But I did want to bring up something, you guys, and I don't know if this gets hit on as much or if you guys have done this or even will admit to or have seen it. But
yes, I have.
I can remember. And
something dumb I've probably done before.
I think this is a thing, and it's still in our field. We have there are more female paramedics now than there were in the past 25 years ago or 30 years ago when my wife started. And the fire service is starting to get more female firefighter paramedics. But I can tell you, even when I was partners with her before we were dating or when we were, or I've seen it going on calls with them, where you can have a female medic and their EMT male partner go into a house and the patient will literally start talking to the male there, whether they're the one getting the report or talking to them or anything, and just ignoring the female paramedic who's the lead and who's the highest trained clinical provider on that call. And
you must have read my mind because I actually did want to touch on that.
Yeah, I don't know. That happens, sadly.
And I think that still happens. And I've never really asked some of our female firefighter medics how they feel, but I guarantee you this is still a thing.
It's always they go to the older person or they go to the male.
I've always tried to, when it's the female, I always try, like when it's medic, as an EMT, there's nothing much I could do, but I did learn that I let the female walk in first. And that's always kind of what, like if they're up for the call.
Well, that's a great thing.
You walk in first. Like I'll walk right behind you and I'll kind of stand behind you. Mm-hmm. And that has helped a lot with having that problem.
Yeah, it's a great idea.
But because people, you guys have egos too. I mean, EMS has ego. If you're in EMS, you have an ego of some sort. And so when that does happen, I remember multiple times when I was an EMT, my female partner talked about this. And she's just like, it's so annoying. I walk into this house no matter what. And she was small, petite, so smart, such a good medic. Yeah. She taught me so much of what I am as a foundation as a medic. So many times they came to me first.
It's also like that in the hospital when you would pick up a transfer.
Really?
Really?
Yes. They would always go to give report to the male or the older of the two.
Like the medics would do it?
The nurses that were giving a report.
Yeah.
Huh. Even the female nurses that give report? Dang.
Odd. Very odd.
Have you ever been guilty of that, though?
I have not. I have 100% not.
Well, because it's probably cognizant. It's in your mind. Like, okay, hey, I know to look for who's attending this call, or who's the lead, or who's the medic taking this.
You feel as a female in a male-driven, dominant field that you do have to work twice as hard to prove yourself. Now, again, I'm not that person who says that women can do everything, nor should they do everything that men can do, or vice versa. That is not how I believe that God created us.
Right.
More controversy.
No,
I believe
not
that
controversial for us.
We are made to be, we're made to fit together and to help each other. And, so no. And as somebody whose spouse works in two fields that are scary, I want to know that if you have a female partner, and no matter what you're doing, that they're going to be able to save you if you are in a life-threatening situation. But man, there are some really amazing female paramedics out there.
There are.
That sometimes you lose yourself worrying about working twice as hard to just be, noticed as being half as good, even though you know that is not the way that it is.
Yeah. And babe, you weren't supposed to bring it up about the cop thing. That I just lost all my credibility now.
Yeah. I did not say that. I said two fields that are dangerous. Maybe you're a pilot. Maybe
that's true. Dang,
maybe you skydive. I don't know.
You outed yourself, man.
Yeah.
What's an example of or when have you seen an EMS crew have a really good interaction, picking somebody up or dropping somebody off? Like when have you like that's the best example I can see of somebody doing it well.
I mean, I can't really pick one per se. I've had great interactions with some of the local paramedics when they come to the urgent care. I really have. They're not all bad.
We only want to hear about the bad ones, and we want their names.
A lot of them are. A lot of them are.
Agency.
But and actually, one of the worst ones came from a female paramedic, which is funny.
Really?
Yes.
She's one of your worst ever interactions?
She's like, I'm not signing that. She's like, I've never had to sign that piece of paper. I was like, okay, suit yourself. like I don't care.
He's staring at you.
I'm staring at that's an inside between Josh and I.
Like, you don't have to sign anything. I'm not going to force you.
Yeah.
Whatever. But why are we? But why are we causing
facility? Is it? Are those patients considered inpatient?
They are a transfer. Yes.
Because it's in St. Luke's. Oh, I shouldn't even say. It doesn't matter. What if it's a urgent care that's attached to a
you get a transfer form.
Oh,
I don't feel like I've ever got a transfer form from any of the urgent.
What about the privates?
I'm saying, was it a hospital based, or was it like one of the private?
It was a hospital based.
Really?
I never. Well, okay, that was in Illinois.
Think about this
that was in Illinois.
That was the one you refused to sign. I'm not signing that.
It's happened because they wouldn't be laughing about it.
It was in Illinois. So that I'm thinking of the one in particular, urgent care. I went there at least once a shift, and they never gave me any forms to sign, nothing like that. There was no it was just a 911 call.
Who knows? I mean,
but that was Illinois, so maybe it's
we could just be making up rules along the way.
That's right. But the bottom line is that female paramedic was like, I'm not signing this.
Correct. And
That's
I'm like,
crazy.
Okay.
Right. It doesn't matter to you. You're like, hey.
But again, it goes back to the whole, kindness is free. Like, why you got to be like that? 100%. I don't, like, there's, what did you just prove? All you proved to me is that you're a jackass.
Yeah.
Yep. You attract more bees with honey than vinegar.
Right.
Yeah. And I think that, man, just like you said, like we can be rock stars
every day.
and our care can actually be subpar. But if you're one of those people that walk in there with a smile on your face, every patient you go on, you're like, yeah, what can I get you? Is there anything? Holding their hand, all you did was take some vitals, and you've been now listed as the best firefighter paramedic or best paramedic in the world because you were nice. Mm-hmm. Like you could be actually the worst skilled provider ever, but your patients think that you're amazing because you're just a nice person.
Right.
Yep. Kill them with kindness.
Yeah. I mean,
and when you're nice to the staff, then when you have to go back, they're going to do nice things for you.
Yeah.
So like your patient may be cleaned up. They may not be laying in 3 hours worth of poop. They might have a clean Depends on, or your patient might actually have a large bore IV in them, or they might have a 12 lead EKG. All these nice little things that they might do for you. But if you're not nice, And they're going to be like, I sealed the EKG in the sealed paperwork, but you don't get to see it.
Yeah.
Do your own.
Dig through your own. Yeah.
Let's try to end on a happy note here. What is one thing that a nurse and a paramedic, since you've been on both sides, what can you say as a nurse to paramedics, like this one thing that you do for us is really impactful? Vice versa, what is one thing that, nurses do for paramedics that's super impactful?
I think just respect.
On both sides?
On both sides. Okay. Because, again, nurses a lot of times see paramedics and they're like, oh my gosh, these dumb paramedic firemen are coming in here. They don't know anything. It's true. And paramedics are like, these idiot nurses, I think just respect. Like, take it, I'm going to give you a report or you're going to take a report from me, like that you actually care. I can care about the patient all day long, and do what's best for the patient. And think about it in that aspect. You're trying to prove something, like that you're smarter than me, or I'm trying to prove that I'm smarter than you. And don't let the patient care get lost in that, because essentially that is what happens. Yeah. The only person that gets the short end of the stick is the patient.
Right.
Because at the end of the day, it really doesn't matter if you're smarter than me or I'm smarter than you, or who knows that. Putting aside all of your ego on both sides of the fence and treating people with respect ultimately is, and nobody knows. I don't know what kind of call you just went on. You don't maybe know what I had going on 5 seconds earlier.
Right. That's a good point.
Just the bottom line is just respecting.
Yeah, absolutely.
Just hearing all the nurses' stories, you go from one room, which is just me, Ma, being chill, to the next room, which is a psych patient. Yeah. The next room, which is a nasty
6-week-old SIDS that you had to wrap up and hand to her mother.
And then now you have a rude paramedic coming in because, and rushing you to get the transfer paperwork ready. Like, I can admit
or vice
that
versa.
Maybe I was a little rushing. I've rushed nurses to get paperwork ready. And maybe I didn't take into account the kind of day they're having.
Or, maybe you just were on a 3-year-old drowning and then you brought in grandma who's in her, dirty Depends for the last 6 hours. And I'm like, seriously?
Yeah.
It's just bottom line is respect. Whether you've been doing it for 5 minutes or whether you've been doing it for 50 years.
Yeah.
Which was the hardest transition for you for each role? Which one do you think was the hardest?
Actually, the hardest was when I was floating, going from ER nursing to med-surg nursing, of all things.
Why was a med-surg?
Because now you have several patients to take care of for 12 hours, all at the same time. And it is very hard. And I cried a lot.
Oh, yeah.
Like you think more difficult than the ER?
Oh, absolutely.
But you had more than one in the ER, right?
Yeah.
But
about
she would
3 or
ship
4.
them off eventually.
But you have them and then they
discharge.
Yep, and then they're done. This you have 12 hours worth of meds to give to someone, to give to 8 people. And an assessment to do and to get everything charted, and then everyone
and if you have 2 annoying patients, then you have
they're
2
on their
annoying
call
patients
lights
for 12
and,
hours.
Yes. And you have 6 other patients that you have to take care of, or 4 other patients, however many you're taking care of at the time. Yeah. That was the hardest transition. Sense. It was horrible.
Yeah.
So give your med-surg nurses some respect too.
Is that why they're always, there's a big rift between ER nurses calling report to floor? Is that part of it?
Probably.
So my wife talks about that all the time.
Yeah, everybody is, and I think that there's been some beauty in me being able to do, I've done geriatric psych also, another set of nurses that don't get a lot of respect. But, when you hear someone scream for 12 hours at the top of their lungs nonstop.
I can't
I'm good on that.
And you still have to be able to do your job. Like,
Stop it right now.
Right. But I'm just, I think, again, it all boils down to just giving everybody respect.
Yeah. You guys, and to end on this one, it's so funny because I'm trying to diligently listen to what she's saying here because I know she's got a hidden message for me.
You're doing really good, Sean. You're doing amazing.
I go back to this one thing.
I don't hide many messages.
No, this one thing that she talked about with me, this has been about 2 weeks ago. I don't know if you guys get into show cheating with your spouses and all that other stuff. We try not to show cheat on the ones that we're like.
No, I try not to.
I do. I don't always show cheat. If I'm at the firehouse and there's something I really want to see, like I need the next episode.
Oh, I get
even though we're like together.
Oh, okay.
I was trying to figure out what you meant by show cheating.
You guys don't know what I'm talking about?
Lost.
Like TV show cheating, all right?
Okay.
I'm not talking about real life, all that stuff.
You tell your spouse that you're going to be watching the show together and then you go to the firehouse.
Right.
Heaven's face, but you guys were totally lost. You're like, what?
I
I don't think what you're talking about is appropriate, dude. So what happens is I do hog a lot of the TV. Like I've got a lot of things that I tell her. It's a very important game. Every game is an important game, no matter what I'm watching, whether it's soccer or baseball or whatever. Well, anyway, so we'll have a show where she's really into something, and she'll pretend, even like with soccer, like we have season tickets. She's not like a soccer fanatic, but she does it because, she does it because I love it. And she goes with me.
I still haven't been to one.
You know what I mean? And so she'll have a show where I'm like, oh yeah, babe, I'm going to go in the other room and watch something that I like. Instead of me sitting there for a second going, well, I'm going to stay in here with her and spend a little bit of time. Even if it's a show I don't love, I can pretend to like it for the time that's in there.
I'm not asking you to watch Hallmark.
You know what I mean? And it's the same
I
thing.
can watch the Hallmark stuff.
Is it 90 Day Fiance?
No, I don't watch that either.
No, I think what I'm trying to get at, the point here is in life, this is the same for all of it. The respect, or at least the showing of respect for each other, doesn't take a whole lot of effort, but it does take some effort. And I think that it just really shows like how much you care if you literally can't put in 5 minutes to listen to what somebody else has to say, or at least pretend like you're listening and you care about what they have to say.
Right.
That can go a long way. Even if you're totally going to disregard, and that's on you, what they say later, at least giving them your full attention and pretending like you care is the difference.
Yeah.
You know? So anyway. All right. Well, I think this wraps it up.
Yeah. That was awesome.
Time flew by. Yeah. We really
Thank you for
appreciate
coming.
it.
Appreciate it. This
Thank you for
awesome.
having me.
Yeah. All right. Well, stick around. We'll see you guys on the next ones, and we'll keep at this and see how everybody likes it. So,
Yeah.
All right.
Hey, thank you guys for watching our episode with Liz Karl about her perspective in the urgent care. Please like, comment, subscribe. All of our socials. We're on every single platform that you can think of for recording audio, video, especially our YouTube or Spotify. Thank you all for watching. See you later.